In this video, we'll look at 12 rare indicators that could point to heart disease. It's important to recognize these signs in order to take necessary steps to prevent the condition from worsening. Black small square. The common belief that heart disease always accompanies obvious symptoms is somewhat flawed. In fact, factors like silent inflammation, unnoticed stress, and poor oral hygiene can all contribute to heart disease. Among the misconceptions is the idea that only the elderly or those with poor lifestyles are at risk of heart disease. In reality, conditions like sleep apnea, chronic mental stress, and neglecting dental health have significant effects, and the list is not exhaustive. Black small square. If you want to check for discrete or hidden heart problems, stick around and watch this video till the end. We'll also discuss some basic lifestyle changes and medical measures to improve your heart health and prevent further damage. Our first clue is swelling or pain in the calves. This could be a warning sign of peripheral artery disease and is often associated with heart damage. This disease develops when the arteries in the legs narrow or become blocked, resulting in reduced blood flow. It's important to notice this symptom as soon as possible, as it could be indicative of more serious cardiovascular conditions, including heart disease. If your calves are swelling or feeling uncomfortable, especially after walking or climbing stairs, be cautious, as peripheral artery disease is often associated with atherosclerosis, a condition where plaque builds up in the arteries. To avoid further complications, it's recommended to make lifestyle changes such as exercising regularly, adopting a heart-healthy diet, quitting smoking, and consulting a healthcare professional. Remember that recognizing and intervening in these early signs will help keep your heart healthy. Now, let's move on to our second clue. Sometimes overlooked erectile dysfunction can be an early indicator of heart disease. This issue is more than just a personal discomfort. It's a serious health problem. Erectile dysfunction often stems from underlying cardiovascular problems such as blocked arteries or heart disease when adequate blood flow to the penis cannot be achieved. Understanding that processes leading to heart disease can affect blood vessels throughout the body, including those leading to the sexual organs, is crucial. If you're experiencing this issue, it can not only affect your sexual health but also your heart health. It's important to address this symptom by tackling lifestyle factors, seeking medical advice, and managing other risk factors for heart disease. Moving on to the seemingly harmless but potentially indicative sign of gum bleeding as our third indication. Gum disease, also known as periodontitis, is often associated with cardiovascular health. Persistent gum disease can lead to inflammation, swelling, and bleeding of the gums, which is believed to increase the risk of heart disease. Bacteria from inflamed gums can enter the bloodstream, leading to plaque formation in the arteries, thus harming heart health. Taking care of your oral health is not just about preventing tooth decay but also about preserving heart health. Regular dental checkups, proper oral hygiene, and early detection of gum disease symptoms are important preventive measures. Our fourth indicator, often considered minor discomforts but could be signs of more serious heart problems, is snoring and sleep apnea. Sleep apnea, characterized by pauses or shallow breathing during sleep beyond loud snoring, is a serious condition that disrupts your sleep cycle and restricts oxygen flow in your body, thereby harming your heart. People with sleep apnea often have high blood pressure and irregular heartbeats, increasing the risk of heart disease and stroke. If you or your partner notice excessive snoring or breathing gaps, consult a healthcare professional for proper diagnosis and treatment, which may include lifestyle changes, CPAP equipment, or other interventions. Taking sleep apnea seriously could be a crucial step in saving your heart. Now, let's move on to our fifth indication. Sudden onset of acute fatigue that could suggest a heart attack. This severe weakness or fatigue is more than just tiredness. It's a powerful, irresistible feeling of exhaustion that can strike without warning. This indicates that your body is not efficiently functioning, resulting in reduced blood circulation and oxygen supply to muscles and organs. This feeling, especially when accompanied by other heart attack symptoms like chest discomfort or shortness of breath, can be particularly dangerous. If you experience such acute fatigue, seek medical help immediately, especially if it occurs suddenly and unexplained. as it could save your life. If we move on to the sixth sign, irregular rashes or strange spots, they could be more than just a skin problem. They could also be subtle indicators of heart problems. Some skin rashes, like psoriasis or eczema, are associated with an increased risk of heart disease. These skin conditions are characterized by inflammation, which is the main cause of atherosclerosis development, leading to hardened arteries that can cause heart attacks. Additionally, some rashes or plaques could be due to poor circulation, which is another indication of heart problems. Pay attention to sudden or chronic changes in your skin's appearance and consult a healthcare professional to determine the underlying cause and its connection to heart health. Moving on to the seventh indication, namely unexplained nausea or indigestion, it's important to remember that these symptoms could indicate more than just digestive issues. They could signal heart problems. People experiencing a heart attack may have symptoms like indigestion, nausea, or stomach pain. Antacids and other gastrointestinal medications are often ineffective in relieving discomfort. These symptoms occur because the heart struggles to pump oxygen-rich blood to the digestive system during a heart attack. These warning signs should not be ignored, especially if other heart attack symptoms like chest pain or shortness of breath accompany them. Urgent medical attention may be necessary to treat the underlying heart abnormalities. Now, let's look at indication 8, chronic hoarseness, which could be an unexpected but possible sign of heart failure. Persistent hoarseness may occur when the heart fails to pump blood efficiently, leading to fluid buildup in the lungs, which can damage the vocal cords and cause chronic coughing. This symptom is often overlooked but could be associated with impaired heart function. If you experience continuous hoarseness without a specific cause and other symptoms like shortness of breath or fatigue accompany it, you should consult a healthcare professional. Early detection and treatment of heart problems can be the key to long-term health and well-being. Moving on to the ninth indication, syncope or fainting, which could be a dangerous sign of heart disease. Fainting occurs when the brain is temporarily deprived of adequate blood flow. This could be due to irregular heartbeats or blockages in circulation. Fainting is particularly problematic if it occurs suddenly and without any prior warning signs. While fainting can have various causes, frequent fainting or fainting accompanied by chest pain or shortness of breath requires immediate medical intervention to rule out underlying heart problems. Early intervention can prevent more serious heart events. For our 10th indication, let's look at sudden or severe sweating, which could be a precursor to a serious heart problem. Excessive and unexpected sweating, especially when not related to physical activity, could indicate a heart attack or other serious heart conditions. It occurs when the body responds to stress signals emitted by a malfunctioning heart. Symptoms like chest pain, pressure, or shortness of breath may accompany this type of sweating. Rather than attributing this indication to less serious issues, it's important to consider it as a potential heart problem. If you experience sudden, unexplained sweating, especially if it's intense or accompanied by other heart issues, seek immediate medical help, as it could save your life. The 11th indication is exceptional or prolonged anxiety. This is not just a mental health issue but could also be a sign of heart problems. Anxiety can manifest physically by affecting heart rate and blood pressure. In some cases, especially when sudden, severe, or accompanied by discomfort or shortness of breath, it could signal an underlying cardiovascular issue. While anxiety has many origins, it should not be neglected, especially if it's new or significantly worsening. Consult healthcare professionals to examine both psychological and physical aspects for heart and overall health preservation. Lastly, indication 12, a decrease in exercise tolerance, could be an important sign of heart damage that shouldn't be ignored. A sudden decline in the ability to engage in physical activity, experiencing unusual fatigue or shortness of breath during or after exercise, or chest tightness could indicate cardiovascular problems. This decrease often results from the heart being less efficient in supplying blood and oxygen to the muscles. It could be due to heart disease or blocked arteries. Consulting a healthcare professional if your exercise tolerance significantly changes can help in promptly addressing this symptom, leading to more effective identification and management of heart problems. Now that we've covered possible indicators of heart damage, let's look at significant steps you can take to improve your heart health and prevent further damage. It's never too late to start making these adjustments, and small actions often lead to significant improvements in cardiovascular health. First and foremost, focus on your nutrition. Limit your intake of saturated fat, trans fat, and cholesterol-containing foods. Opt for a diet rich in whole grains, fruits, vegetables, and heart-healthy omega-3 fatty acids found in oily fish like salmon or mackerel. Limit your salt intake to control blood pressure, limit weight gain, and sugar intake to prevent diabetes. 2 factors that strain the heart. Physical activity is equally important. Engage in at least 150 minutes of moderate aerobic exercise per week or 75 minutes of vigorous activity. It not only helps maintain a healthy weight but also reduces stress and strengthens the heart muscle. Monitoring and maintaining good blood pressure, cholesterol levels, and diabetes levels are important. Regular checkups and adherence to prescribed medications can help keep these factors under control, significantly reducing the risk of heart disease. Don't underestimate the importance of quitting smoking and reducing alcohol consumption. Both factors have significant adverse effects on heart health. Quitting smoking can significantly reduce the risk of coronary heart disease, among other benefits. Mindfulness, meditation, and yoga can help manage your stress. Chronic stress can lead to behaviors and variables that increase the risk of heart disease. Finding appropriate strategies to manage stress can benefit your heart health and overall well-being.